All right, so I'm going to check my physician's orders with my mark. Okay, so here I see I have gentamicin 60 milligrams, IV piggyback every 8 hours. It says the same thing right here. I'm checking for allergies, and I see that my patient doesn't have any allergies. So it's the correct solution, and it's the right rate. And I'm also going to come over here and it says that it can be diluted in normal saline or D5W, and I see that's what I have right here hanging. Okay, rate of administration, it says each single dose properly diluted over 30 to 60 minutes, but we're going to do our 60 minutes. And this is used for the treatment of infections of the GI, respiratory, or urinary tracts. Okay, per things that I'm gonna watch, I'm gonna watch for a decrease in urine output and a raising. I'm gonna look at the bun and grab at the bun level, BUN level. I'm gonna look at the calcium, magnesium, sodium, and potassium. Those are some things that I'm gonna check, okay? And also I'm going to tell my patient to let me know if they have any signs of burning, dizziness, fever, headache, or anything, itching, or anything like that, okay? All right, so now I've checked my, to see if it's compatible, rate of administration, and all of that. I'm done with that. Okay, so now, I read my doctor's orders right there. All right, so now I'm gonna come over here, I'm gonna get my medicine, and I'm gonna make sure that it is gentamicin. It says 60 milligrams, IV piggyback every 8 hours. Okay, and so I see that I have the right medicine. It's gonna be the right route. All right, so now I've compared the two, and I need to label. So I have gentamicin, 60 milligrams, and if it were by pump, it would be 100 milliliters or 17 drops by gravity. Okay. Okay, I'll put the date and time. Okay, and I'll put the patient's name. So, okay, all right. So now I am gonna label that. Now I need to prime my tubing before I get ready and go to the room. And before I start preparing anything, I need to wash my hands. Okay. So now. I'm priming my tubing right now. okay? Alright, so now I have my supplies and I am ready to go to my room, okay? So, knock knock, can we come in? I'm gonna explain my procedure. My name is Amber Jones. I'm gonna be giving gentamicin to you today. It's IV piggyback. Can you tell me your name and date of birth? They tell me their name and date of birth. I'll compare it with their armband here. I also look at my mark. And I'm gonna ask them, do you have any allergies? And I said they have none. All right. So also, I'm gonna check for compatibility of what's already running. Okay, I'm gonna wash my hands. And I need to check to make sure that the line is patent. And so I would get backflow. And so I see that it's patent. Okay. So now I'm going to okay, wash my hands, and I'm looking at their site to make sure that it's dry and intact and patent and everything. Okay. All right. So now I need to lower my primary set. So now I'm going to clean my port for 30 seconds, okay? Okay, so gotten that clean. All right. Okay, and so I have this shut off. Okay, and I shouldn't have touched the, hold on, this top on here. Okay, got it off. All right, and so if I touched anything, I know I need to cleanse it with alcohol, okay? All right, so now that I have them connected, I can open up my secondary tubing. And now, since we're doing this by gravity, I need to, okay, so I got this open. Okay. Then I need to start manipulating it with my primary. Make sure all my lines are open. And at this time, I'm gonna regulate my drops.